All attendees are in listen-only mode.
Hi, good afternoon, everyone, and welcome to today's educational webinar brought to you by Physician Resource Center and Physician Partners. Today's topic is Meaningful Use Stage 2 and ICD-10. We have a guest speaker today, which is Teresa Gonzalez-Propati from Physicians Trust. She is a certified eClinical Works trainer. She has 12 years in healthcare, 8 years as a medical assistant with Scripps and other practices. She is, again, certified EHR trainer and MU attestation expert working with the regional extension centers, IPAs, and health systems. Before I turn it over to Teresa, just a quick note, everybody will be muted during the broadcast today just to avoid any background noise. Any questions that you do have, please feel free to type them in during the webinar. As we get to the end of it, we'll field all of the questions and answer them in the order in which they have arrived. So without further ado, Teresa, welcome.
Thank you, Dustin. Good afternoon, everyone. Thank you for spending your lunch hour with me. We're going to go ahead and just jump right in here. Our agenda, we are reviewing our meaningful use, changes from stage 1 to 2, ICD-10 overview, and your roadmap to 2015. Hopefully at this point, everyone is familiar with what is meaningful use. Now, if you are going to start in 2014, you will have a potential incentive payment of $24,000. That's over 3 years of demonstrating your meaningful use. If you are a Medicaid EHR incentive program provider, then you will still have the full amount, $63,750. That is over 6 years of demonstrating meaningful use. Now, one thing that has become kind of confusing is with Medicaid, you do have the opportunity to skip a year. But if you are also a Medicaid and Medicare provider, you do not have that option. Even if you are attesting for Medicaid, if you were to be a Medicare provider and a Medicaid provider, you skip a year, then you could potentially get the payment adjustment. Eligibility: Medicare, MDs, DO, dental, medical, surgeon, podiatrists, optometrists, and chiropractors. Now, those same providers for Medicaid, also nurse practitioners, CNMs, dentists, and PAs, but only if they are with an FQHC or rural health center that's led by a PA. Last year, to begin your participation, if you are Medicare, is 2014. If you don't adopt by 2014, then January 1st of 2015, you will receive a payment adjustment of 1%. That 1% will increase every year of not meeting meaningful use. One of the things that's very important, if this is your first year of meeting meaningful use, 2014, your stage 1 is your first time, you have to do 90 days. But your 90 days need to be completed, and you need to have submitted your attestation to CMS no later than October 1st. If you miss that October 1st deadline, then January 1st, 2015, you will receive a payment adjustment of 1%. If you are starting meaningful use stage 1 in 2013, then 2014, you will still be in stage 1. So you need to do 2 years stage 1 before you move on to stage 2. Again, this is a reminder about not missing that deadline for October 1st. First 9 months of the calendar year, it's mandatory. And that is, keep in mind, if your EHR produces a dashboard, which every EHR that is certified has to in some manner produce a dashboard that produces your numerator and your denominator. Most of these EHRs produce that information a month later. So if you are doing your 90 days, you need to take that into account. So you need to be completed, have your dashboard in front of you no later than September to make sure that you get that into CMS prior to October 1st. Also, another thing to keep in mind is that CMS is severely backlogged right now, and they have implemented a new rule regarding passwords. So if you are a provider that has not used your password since last year's attestation, then I suggest that you call CMS and get your password reset. The sooner you call, the better. And I'm going to give you guys a number, and it's 866-484-8049, and that is option 3. And I will make sure that Dustin has that available. That is the CMS number for resetting your password. The provider does need to be available. He will need to verify some information. Keep in mind that line sometimes takes more than an hour to reach an operator. So your password will need to be reset if you haven't used it last year, and it will need to be reset every 180 days. Changes from stage 1 to 2. You still are going to have 20 total objectives, but instead of having 15 core and having to meet 5 of 10 menus, you're going to have 17 core and meet 3 of 6 menus. That's because a lot of the stage 1 objectives are now core objectives. Thresholds have been greatly increased on some items from 50% to 80%. Clinical visit summaries went from 3 days to 1 day. Very significant changes for stage 2, secure messaging. That involves your patient portal. If you haven't already started getting that portal up, you need to jump on that immediately. Patient portal, family health history, imaging results, registry reporting, electronic progress notes. Now there's also updated requirements for lab results. It's a higher threshold. Patient list is no longer a menu, it's a core. Patient education is now a core. Summary of care records, that's a core. Medication reconciliation, immunizations. Now, for my San Diego providers, immunization registry up until 2014 has been a test, that you're sending a test HL7 document. For stage 2, your immunization registry is actually a data exchange. So you may have already been receiving emails from them. It's very important that your data exchange is done during your quarter that you are going to report. That is the only way that that is valid and that you will meet meaningful use. Patient reminders and online patient information. We're going to discuss audits. I know this makes everyone cringe, but it's a reality. 5 to 10% of providers are subject to audits. They're random, and if you're doing something that is suspicious, they're going to catch you on it, and it's going to trigger an audit. That would mean if you are reporting items that are not on your dashboard 100% as good as all of my providers are, it's rare that you're seeing someone meeting 100% on everything. CMS will not make the risk profile public. So what you need to do is for everything that you are attesting to, you need to have proof. Postpayment audits began in July of 2012. That means they issued the payment to you, and a year later, 2 years later, up to 6 years later, they can say, prove it. 2013, they started doing audits, and this is for Medicare. They started doing prepayment audits. which basically what happens is you submit your attestation and it says that it's locked for payment, and then a few weeks later you get an audit letter saying, go ahead and prove it to me now before we release the payment. Now, the reason I say this is only for Medicare is because if you are a Medicaid provider, as you know, when you attest, you have to submit proof for each and every measure as you attest. It is your responsibility to maintain your documentation. Do not rely on CMS to give you what you have submitted to them. If you go on the CMS site under status, you can print out a copy of what you submitted, but you have to have screenshots and documentation from your EHR to support your attestation. That information must be retained for 6 years post-attestation. I recommend that everyone save it as an electronic and a paper copy. Printing your visit summary is a huge challenge, not only for your attestation, but for proving for your audits. If you are at 49.89%, that is not 50%, please do not attest with it. The California State Immunization Data Submission, that is your HL7 test. Make sure that that is submitted before you attest that you have done it. The security rule, that is a self-attestation measure. That means you are not submitting any numbers, you are not submitting proof at the time of attestation, but it is a requirement. Electronic data exchange of key clinical information. Now, this item is deleted for 2013, but for stage 2, that is back on the books, and that is electronically sending your referrals to another provider. But not only just a provider in your own EHR, it is sending one to a provider in another, using another vendor. Patient engagement, once again, that is your patient portal. That's mandatory for stage 2. Document, 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 document. I cannot say it enough. If you do not have the documentation to prove it, do not attest to it. At this point, everyone's just saying, okay, the heck with it, I'm done with meaningful use. There's a lot of reasons why you can't be done with meaningful use. 1, you want to avoid that payment adjustment. And 2, there's reasons for meaningful use. You know, you're capturing that data, you're sharing that data, we're trying to improve patient outcomes. But you have to understand that it is a team sport. A provider cannot do it on their own, and neither can the staff. You have to all work together and everyone take a part in this. Now, everyone take a deep breath, and we are going to talk about ICD-10. So as you can all see, that big huge code up in the right hand corner, V9733XD, sucked into a jet engine subsequent encounter. That is a true code. Why do we need ICD-10? So this is the by the books, word for word CMS wording. So let's just break it down and talk about it in real terms, okay? ICD-9, it's old, the terminology is old, and it lacks the relevance to the current practices. ICD-10, you're telling, it's on the left-hand side, it's the first time, it's, you know, you're giving lots of information regarding severity, regarding, you're getting patient safety information, resource utilization, quality measurement in your claim data. All of that is not available with ICD-9. Now, CMS has started down the road of paying for the procedure, pay for reporting, pay for performance, pay for quality, pay for managing the health of population. But the documentation has to support all of that. ICD-10 diagnosis will be used by all providers in every healthcare setting. Now, good thing is, procedures will only be used for hospital claims for inpatient. There is no impact right now with CPT and HCPC codes. So that is a good thing, a very good thing. Starting October 1st, 2014, it's going to bring global alignment with other developed countries. That means that if you move from San Diego to Europe, your health information can be easily translated there. So it's not them looking up on the internet an ICD-9 code. It's the ICD-10 codes, and everyone's using them. Starting October 1st, that means all payers, providers, and clearing houses. The impact. You are going from 4 procedure codes, and this is hospital, to 13, but you're going from 69,000 to 72. Very important that you understand what the reasoning is. So, because with ICD-9, you had the 3 digits and you had the dot and then the 2. So now you're going to have the 3 is your category, which is always the same. The etiology, which is the cause, the site, the severity. Now the extension is the visit encounter. So is it the first encounter? Is it the extension? Is it subsequent encounters? Most far-reaching changes in the U.S. healthcare to date. This is the biggest change that they're saying probably since they started the ICD-9 system. Now, a lot of people are waiting to see if it just is going to be delayed. I know that the AMA has requested a delay. CMS is saying that's not going to happen. I strongly urge everyone to not count on that. Don't count on getting a delay. Don't count on not having to implement this right now. Now here's some more ICD-10 codes. And this, although it's humorous, it does show you that this ICD-10 system encounters all countries. So we may not have here in California struck by a turtle, but maybe somewhere in Europe that is something that happens. How do you prepare? Very important that you identify what your vendor is going to do to accommodate ICD-10. Very first person you need to talk to is your vendor, because with not only ICD-10, but with meaningful use, whether you are stage 1 or stage 2 this year, you need to have an EHR upgrade to continue with certification. So you need to see what your vendor is doing for ICD-10. You need to discuss a plan with your clearinghouse if you have a billing service, all your payers. Identify your changes to your workflow and to your business processes. Think about your templates. Think about your cheat sheets. Get staff training if that's needed. Conduct your test transactions with your payers and your clearinghouse. Now, unfortunately, this is going to take time, and it is going to cost you some in implementation, system changes, resource materials, and training. So make sure you budget for that time and that cost. One of the most important things out of this list, I think, is finding your top codes. Right now, most providers have a cheat sheet of 25, 50, 100 codes that they use. Start converting those to ICD-10 codes. There's lots of resources that are free on the internet. If you're using an iPhone, there's apps already out there. Start getting that converted. Start looking at your templates and figuring out how that needs to be converted also. Now, because I am a eClinical trainer, I can tell you that eClinical as a vendor will have an automatic conversion. I suspect that other vendors are going to have the same thing. So I want you to have this discussion. So as you can see here, it says ICD-10 code for asthma was 49390. So now it's saying, do you want to take it to J45.909 or J45.998? And then if that was the correct code, you would say apply. So the same thing on the lower hand, it's telling you right ankle, left ankle, unspecified. So check with your vendor and see what they have available to help you. Now, once again, this is the same thing. It's a team sport. Everyone has to help. It's going to change everything. It's going to change from how you bill to the questions that your MAs ask your patients. So instead of having in your chief complaint, that they've had, ankle pain for 3 days, you might need to ask, which ankle, how did this happen, and has this ever happened before? So make sure that you're talking to everyone in your office. It's your front desk, it's your coders, your billing, your lab. You're going to have increased documentation for submitting labs, your nurses, your forms, your HIPAA forms, your policies and procedures. Now, your roadmap to 2015. So January, February, we're already in February, but you need to assign who is your ICD-10 and meaningful use champion. Now, I know it's really difficult this year with so many things happening at once. You have an EHR version upgrade. You have possibly stage 2 of meaningful use, and you have ICD-10. I urge you to not try and do them all at the same time, keeping in mind that meaningful use for stage 2 is a quarter. That means January, February, March, but only if you had already upgraded to the newest version of your EHR. April, May, June, July, August, September, October, November, December. So make sure that you are keeping that in your head, that it is on the quarter, and try not to have that collide with your ICD-10 mandatory start of October 1st. Again, this is showing you although they're humorous, it is showing you that the codes are changing drastically. So at this point, I am done with the presentation, and we'll go ahead and open it up for any questions.
Thank you very much, Teresa, for the very detailed overview of everything. That's a lot of information to cover in a short amount of time. If anybody does have any questions, please go ahead and use the GoToWebinar interface to type them in. We can go ahead and answer them. One slide that I really wanted to take note of, I'll go back here just a couple. Now this one right here. I think this is a really good roadmap slide that shows the detail of how fast this is coming on.
Definitely. And if you look at this, we're already just about at the March 2014. So make sure that you're upgrading your EHR, that you've already contacted your clearinghouse, you're educating staff, because stage 2 of meaningful use is different. It's a lot different. The thresholds are higher. It's involves your patient portal, which means you're going to have an engagement plan.
Yeah, and another slide too, as I scroll back here real quick. There we go. This is, I know this really depicts ECW, but it is rather intuitive when you do the upgrade and you have everything working the way it should. It's kind of a walkthrough intuitive system on how the ICD-9 coding converts to ICD-10. It's definitely not a complete question mark.
Correct. It definitely will, and hopefully all EHR vendors are following this lead. It definitely will try and urge you forward on getting the correct code. The issue here, though, will be, have you already collected that information from the patient? Mm-hmm. So that would involve working with your staff and making sure that you're collecting that information so that you can code effectively.
Yeah, the interview process changes up a little bit.
Correct.
Well, we haven't received any type-through questions yet, but I just wanted to put the contact information up. Also, we have Teresa's contact information, so if anybody has any questions, we'll go ahead and provide that information to you. The slides will be provided also by Teresa and Physicians Trust. Those will be emailed out to everybody tomorrow. But again, if you have any questions in the meantime, feel free to contact us here at the office at Physician Partners, or you can contact Teresa. What's your email address at Physicians Trust?
It's Teresa, THERESAG, at physicianstrust.net. And before we actually leave, I did want to remind everyone of one more thing. And the CMS has extended the deadline to March 31st.
Oh, yeah, that's right.
Okay.
Yep.
So the deadline was February 28th at 11:59 Eastern Time. They have extended that to March 31st, 11:59 Eastern Time. Now, the reason for that is there has been a lot of problems with the site. So I urge you to not wait. Attest as early as you can. Now, we do have a question. When do we have to start Meaningful Use 2 if we've attested for Meaningful Use 1 for the past 2 years? So that's a very good question. Now, you would need to do Meaningful Use Stage 2 in 2014. Keep in mind that has to be on a certified EHR for 2014. So depending on who your EHR is, you are going to have to do an upgrade prior to that. Now, your Stage 2 attestation is for the quarter, which means that January, February, March is already gone. So you could look forward to April, May, June, or July, August, September, October, November, December.
Okay, great. Well, thank you so much, Teresa, for posting this. As always, you do such a great job. Again, the slides will be out to everybody tomorrow. And if you have any other questions in the meantime, please feel free to contact Teresa or here at the office. Thank you, everybody, and have a great day. Bye-bye.